It's easy to miss. Someone laughs at your jokes, shows up to work, texts back with an emoji or two, and you think, they're fine. But behind that smile could be a storm. Behind that, I'm just tired, could be an invisible battle with anxiety or depression. And let's be honest, we all have bad days. Stress, burnout, low moods, they're part of life. But when do those feelings cross the line into something more? Something that needs real attention? Welcome back to Pharma-Logic, where we bust myths, unpack medical facts, and shine a light on the stuff that really matters, like mental health. Today, we're diving into something close to the heart: how to recognize anxiety and depression early. Not just in yourself, but in the people you care about. Because it's not always obvious. And sometimes the person who needs help the most is the last to ask for it. Let's start with anxiety. It's not just nervousness before a test or a presentation. Clinical anxiety is like having your internal alarm system stuck on high. Even when there's no real danger, your brain is firing off stress signals, racing thoughts, tight chest, restlessness, irritability, and sometimes full-on panic attacks that make you feel like you're dying, even though your vitals are fine. It can be sneaky too. It might look like perfectionism, over-planning, always needing control, or the friend who cancels last minute because something came up again. Depression, on the other hand, isn't just sadness. It's a persistent low, a fog that dulls joy, drains energy, and messes with sleep, appetite, focus, and motivation. People with depression often say they feel numb, like they're watching their life happen from the outside. The world keeps moving, but they feel stuck, like trying to run through molasses. And here's where it gets tricky. Many people hide it. They show up, smile, say, "I'm fine." But their texts get shorter. Their laugh feels a little forced. They start turning down plans or ghosting group chats. It's easy to write off. They're just busy, right? But sometimes that distance is a sign they're struggling. So how do you recognize the signs in friends or family? You don't need to be a therapist, just a good observer. Have they been pulling away from things they used to enjoy? Do they seem more tired, more quiet, or more on edge than usual? Are they making more self-deprecating jokes or none at all? Maybe their appearance changes. They stop grooming the way they used to, or they seem unusually distracted, forgetful, or overwhelmed by basic tasks. Sometimes it's subtle. They show up, but they're less there. They nod along in conversation, but you can tell their mind is somewhere else. Or maybe they suddenly become over-the-top cheerful, joking more, deflecting everything with humor, as if they're afraid that if they stop smiling, the whole mask might crack. One thing I've learned as a pharmacy student is that we're trained not just in medications, but in mental health awareness. We're taught to listen, really listen, when someone mentions feeling off, or when a caregiver asks for help. We know that SSRIs and SNRIs aren't just acronyms, they're tools, and like all tools, they need to be used thoughtfully, in the right hands, with the right expectations. And more importantly, we know that sometimes the first step isn't a prescription. It's a conversation, a gentle nudge, a safe space. Sometimes the best thing you can do isn't solve their problem. It's just to show them they're not invisible. Here's something to consider. Depression and anxiety often show up differently in different people. In men, for example, depression might look more like irritability or anger. In teens, it might show up as defiance or risky behavior. And in high-functioning adults, it might not look like anything until something breaks. Anxiety can be masked as productivity. Depression can be disguised as withdrawal. That's why recognizing early signs matters so much. It's easier to intervene before things spiral. You don't have to be perfect. You just have to be present. Ask how someone's really doing and wait for the answer. Share something personal if you feel safe doing so. That little bit of vulnerability can open a door they thought was locked. If you notice someone withdrawing from conversations, losing interest in hobbies they used to love, or sleeping all day, check in. If someone who used to be bubbly is suddenly quiet, or the guy who never cancels starts ghosting, it's okay to say, "Hey, you don't seem like yourself lately. Want to talk?" And if it's you who's struggling, please know this: you're not weak. You're not broken. You're not failing. Your brain is just trying to cope, and sometimes it does so in ways that short-circuit your joy. That doesn't make you any less valuable, lovable, or worthy of help. There are so many paths to support: therapy, counseling, support groups, medication, lifestyle changes, or a mix of all of the above. And if you're not sure where to start, you can even ask your pharmacist. We're trained to help you navigate the mental health system, point you toward resources, and explain how medications work, side effects, and how long they take to kick in. And please, let's kill the stigma. Mental health isn't a character flaw. It's not about being too sensitive or just overthinking. It's a medical condition, one that deserves the same respect and treatment as any physical illness. You wouldn't tell someone with diabetes to just get over it. The same goes for depression and anxiety. Here's another tip: keep an eye on physical symptoms. Mental health issues don't just live in the brain. Anxiety can cause chest tightness, nausea, dizziness, or a racing heart. Depression can cause headaches, digestive issues, chronic fatigue, and even unexplained pain. When someone keeps going to the doctor for random symptoms but nothing turns up, it might be time to look at their emotional well-being. As a future pharmacist, I know how common it is for people to hesitate about mental health meds. Will it change my personality? Will I get addicted? Will I need this forever? These are valid concerns, and they're exactly the kind of questions we're trained to answer. The goal of medication is never to erase who you are. It's to help you feel more like yourself again, stable, clear-headed, able to engage with life instead of just surviving it. And not everyone needs meds. For some people, therapy alone is life-changing. Others benefit from a combination of therapy and lifestyle changes, like regular sleep, nutrition, exercise, and mindfulness practices. The important thing is that people get the support they need in the way that works best for them. And if someone tells you they're struggling, believe them. Don't brush it off. Don't offer platitudes like, "It could be worse," or "Just stay positive." Listen, acknowledge their pain. Offer to help them find support. Sometimes just saying, "I'm here for you and I'm not going anywhere," is enough to help someone keep going another day. If you're watching this and you're not sure if what you're feeling counts, it does. Your pain is valid, your struggle is real, and help is available. Mental health isn't a luxury. It's not a side dish to physical health. It is your health. And recognizing the signs early, in yourself or in someone else, can change everything. Literally save a life. So let's normalize asking. Let's normalize noticing. Let's be the kind of people who don't flinch at the words depression or anxiety. Because when we understand them, we take away their power to isolate. Thanks for watching. If this resonated with you, hit that like button. Subscribe for pharmacist-informed health content every Friday at 5 p.m. MST. And drop a comment if you've ever helped a friend through a tough time. Or if someone helped you. Your story might help someone else find the words they need. Until next time, take care of your mind the way you'd take care of your heart. Because both are essential, and both deserve attention, care, and compassion. And remember, the quietest people may be the ones fighting the loudest battles. Be kind, be aware, and never underestimate the power of simply checking in.